This exercise is a prone quad stretch. You should instruct the patient to lie down on their stomach and to bend their knee while reaching back with their hand to grab their foot. This stretch should be held for 30 seconds, 2 times. This should be done twice a day. Compensations include lumbar extension and hip abduction. A modification to this stretch is to use a strap, belt, or towel to assist if the patient can't reach their foot with their hand. This exercise is the hamstring ballet stretch. The patient should be instructed to stand and prop the leg that they are stretching on a chair, table, or other stable object. They should place both hands on the outside of the leg that they are stretching. Compensations for this exercise include posterior pelvic tilt, external rotation of the pelvis or pelvic malalignment, trunk rotation, hunching of the shoulders, and turning the toes into internal or external rotation. A way to progress this stretch is to increase hip flexion or to place the foot on a higher surface. This stretch should be held for 30 seconds, 2 times, and this should be completed twice a day. This is a hamstring doorway stretch, which is very similar to a supine hamstring stretch with a strap. The patient should be instructed to lie on their back near the edge of a doorway. While keeping the knee straight, they should flex their hip. They can use the doorway to maintain the passive stretch. This stretch should be held for 30 seconds, 2 times, and this should be completed twice a day. Compensations for this stretch include bending of the knee, posterior pelvic tilt, rotating the leg internally or externally, and abducting the thigh. Progression of this stretch include increasing hip flexion by moving closer to the wall. This is a quad set. The patient should lie supine or in a long sitting position. You should then instruct the patient to pull the back of their knee towards the table. Another cue for the patient is to watch for superior movement of the patella. This exercise should be done 6 times with a 6-second isometric hold. Compensations for this exercise include contracting the glutes. In our example, we place a pillow under the patient's knee to provide proprioceptive feedback. This exercise is a short arc quad. Instruct the patient to lie in supine or in a long sitting position with the bolster under their knee. Then instruct them to lift their leg up into the air. Have them raise, hold for 6 seconds, and then lower. Compensations for this exercise are the use of hip flexors instead of knee extensors and external rotation of the tibia. This exercise can begin without the use of a weight, and to progress it you can add an ankle weight. You can also use a larger bolster, which will cause them to go through a larger range of motion. Progression can also include a long arc quad exercise. This is a long arc quad. As seen in our video, the patient can complete these lying down or in sitting. Our video shows how you can work a patient's sport, specifically soccer in our case, into their exercise. The patient should extend their knee, hold for 6 seconds, and then flex the knee. Compensations for this exercise include a posterior trunk lean if in sitting, and the use of hip flexors instead of knee extensors in supine. To progress this exercise, ankle weights can be added. This is a straight leg raise. The patient should be instructed to lie down in a supine position or to sit in a long sitting position. The patient will then be instructed to lift one leg up, keeping it straight. A compensation for this exercise is bending the knee, like an extensor lag, or internally and externally rotating the leg. Progression of this exercise includes adding weight to make it more difficult. Considerations for this exercise are to make sure that the foot is dorsiflexed.